So already there is a U.S. intergroup study led by the Children's Oncology Group that follows very nicely from our non-randomized phase 2 study. And in this trial, patients are stratified according to favorable or non-favorable according to the ORTC criteria, and then are PET stratified. So the PET 2 negative patients are randomized to standard of care. They would get 4 total cycles of ABVD. The patients who are on the experimental arm start with 2 cycles of ABVD, and if they're negative, then they get 4 cycles of Brentuximab plus Nivolumab. In the PET positive patients, after 2 cycles of ABVD, they get standard of care with escalated beta-copin radiation versus BV-Nivo plus radiation. Similar design for the unfavorable, though in the standard arm PET negative, they get 6 total cycles of chemotherapy. So I think this is a really important study, and it's randomized, and it will really tell us, do we need to incorporate these therapies? The thing about early stage Hodgkin lymphoma is the majority of patients do very well with chemotherapy or combined modality therapy. So we really have to make sure that we're not causing excess toxicity by adding in these agents. We need to do quality of life assessments, and we will be collecting samples to look at circulating tumor DNA, because I think this is, again, where the field is heading, really being able to identify those patients who become negative early and then significantly peel back on the amount of treatment they need. So I think it's a very large study, 1,875 planned patients. So it's really going to be an amazing, result and data that's going to shape the field moving forward.